Yes, good morning. Yes, my name is Joshua Bwambale, and I am from JIB Research Center for Cancer Response. I am very happy to follow Dr. Harriet, especially after presenting her paper. Dr. Harriet, thanks for the research you did on cancer. Now, background. JIB Research and JIB Research Center for Cancer Response. We are looking at improving and energizing the diagnostic of cancer. And we are centering mainly in laboratories. Basing on the burden of cancer currently, the country has not fully put cancer under the routine health care strategy. And that's what we are looking at. We had a project that we wanted to do in Kasese district, and our desire was to first analyze the current situation on the ground. And so we did a study on exploring the capacity of health, of early cancer screening and diagnosing among health center 4s in Kasese district in Midwestern Uganda. Now, cancer is an emerging health problem in Africa, as Dr. Harriet also stated it. And there's need to address appropriate in order to control the increasing incidence and mortality rates despite risking incidences and mortality rates in Africa. Cancer has been given low priority in research field and in healthcare services. And I think it's because cancer is expensive. And early diagnosis of cancer focuses on detecting symptomatic patients as early as possible so they have the best chance of successful treatment. When cancer care is delayed or inaccessible, there is a low chance of survival, greater problems associated with the treatment, and high cost of care. And now it has been also proved by other researchers that the more you miss cancer, the more you give it chance to grow, the more you give it chance to progress. And so our objective was to determine the preparedness and capacity of early cancer screening at health center 4s in Kasese district. And another one was to establish methods used by the district health team in identifying cancer cases in the district. And so a descriptive cross-sectional study was conducted at Kasese Municipality, Rukoki Health Center 4, Warrior Health Center 4, and Resande Health Center 4. Data was collected using a semi-structured questionnaire from Health Center 4s, in charges who went at a time, clinical officers, nursing officers, laboratory in charges and technicians, laboratory district focal personnel, and the district health officer. Data was entered in the computer and we used EPM data and analyzed using SPSS. And so on the results we got. The results showed that 98% of health center 4 laboratories did not have any capacity to screen for cancer-related infections. And that is basically in the laboratory. And 3% of laboratories had referred samples to commercialized laboratories to screen for cancer-related infections. And so here we are looking at health center 4s, which are in one, of course, Kasese being a mountainous areas. So we are looking at the capacity of, are these health center 4s able to screen for cancers? I mean, either in male or in female or in pediatrics. And so we found 98% of patients coming at health center or at these health center 4s were not being diagnosed of cancer or even being screened of cancer, and which is a very big threat The study also reported that 20% of health center force had participated in cervical cancer and breast cancer screening with support from a funded project. And so we realized that to those health center force which had participated in the screening of cancers, most of them had participated either in a study or in a research or in a project. And it was mainly on cervical cancer or on breast cancer. And so which is putting all other cancers in a black shade. And so health center force which had laboratory staff who had attained bachelor level had a high chance to suspect cancer infections and referred them. Most of health center force cancer infections go unnoticed. And so we realized that to other health center force which had a staffing of people with bachelor levels, basically in the laboratories, had high chances to detect need for referral for samples to test for cancers. And so this comes to our question where we asked ourselves, and so if these cancers go undetected, where do they end up to? So we realize that at the end of it all, these cancers end up at the National Cancer Institute in late stages when you can't reverse it. Yes, and in our conclusion, therefore, health center force do not have enough capacity to screen and diagnose cancer infections in their early stages, leaving most cases to go unnoticed. And our recommendations were there is need to introduce a variety of cancer screening laboratory testing kits on the market to be able to be used at low-level health centers in order to capture early disease detections. Now, this comes to our suppliers, and mainly let me use Chemilabs. There is need to bring to the lowest way of diagnosing these cancers so that we can capture them at low-level facilities. We realize that machines that do PCR and molecular cancer screening and diagnostic methods are very costly. And trust me, it's very hard to maintain them at a very low setting. So it's very important that if we got a variety of diagnostic kits, which are affordable by our system, which are affordable by the people, I mean, it will be very, very easy for people to capture and kick off with the issue of diagnostics at an early age. There is need for Ministry of Health to include cancer on a low health care agenda as a routine procedure, especially for population at high risk. For example, men above 40 years, especially. The research has come and has showed that men above 40 years are at high risk of getting prostate cancer. And just like Dr. Harriet said, women living with HIV have a high risk of getting HPVs. So what are we talking about here? That if there is need for health care, for Ministry of Health to include cancer as a health care routine procedure at whatever level, could be at health center force or hospital or district hospital levels or referral hospitals. Then there is a further need for government to formulate guidelines, train staff, and promote quality control measures. All these with an aim to improve cancer diagnosis at health center force. Here we bring in the issue of quality now. There is need to analyze the quality control method for cancer diagnosis. Could be both in private and public facilities. And the study recommended more studies to be done on other government hospitals and regional referral hospitals to access the preparedness and capacity to do early screening and diagnosis of cancer at early stages. Thank you so much.
And then to Joshua, you focused only on one region. I believe it would have been a good idea to ask, go and assess other regions as well, because this problem is widespread. So I don't know what was the challenge, why you focused on only West, I think it was Western or something like that, not other regions, because it would be better to get the better picture of the whole country so that it can inform policy and decision towards this, because it's something to take up as quick as possible. Thank you very much.
Thank you. Yes, Joshua.
Yes, all said and done. Policy is to make a policy change, to influence policy. We need all stakeholders. You, me, whoever, where all the partners, Kenya, Tanzania, US, everywhere, members, we need to be on board because with cancer, we are not joking. We are not joking. Anyway, the reason why I had, I think, one question. The reason why we chose Kasese was someone earlier had posted a post on Twitter and was like, when you go to Cancer Institute, you will find Bwambale, Masika, Mabira, Wata, and it looked like a joke. But in reality, we have a high prevalence of cancers from Kasese, both from pediatrics to male and female. And we're not taking it for granted because of different risk factors. Kasese had copper in the years back. It was a hub for copper mining, and for the last 70 years, very many things have happened, and there's no control over them. And these deposits go into the lakes, go into our soils, and go into our food, and I mean, very many things that need to be researched on in Kasese. So we had a project we wanted to do, and that's why we had to do a pilot study first before we could have these projects move on. But I am very grateful for the initiative that is taking place, and I'm very sure we are going to collaborate and do great work together. Thank you so much.